Hello, welcome to MedCode classes. I'm Dr. Anjana. Today's class is about tips for CPC examination. You have to be known about the exam pattern and familiar with study materials and should do more mock tests and should have the time management and should be thorough about the guidelines of ICD and CPT and also anatomy and medical terminology, HIPAA compliance and HIPICS. What is the exam pattern? It's an open book examination and there is no negative marks. The exam mode is online. There will be 100 multiple choice questions and the duration is 4 hours to complete the examination and passing score is 70%. That means out of 100, 70 marks should be to pass the examination. This is the exam outline. In this table, you can see the contents and the questions asked from each chapters and also in different subjects. So in CPT from 10,000 series, that is integumentary system, from that chapter you have 6 question, from 20,000 series 6 question, 30,000 series 6 question, from 40,000 series 6 question, from 50,000 series 6 question, and from 60,000 series 6 question. From evaluation and management there will be 6 question. From anesthesia chapter there is only 4 question. From radiology 6 question. From pathology 6 question. From medicine 6 questions. From medical terminology only 4 question. And from anatomy only 4 questions. So there will be only 8 questions about the anatomy and medical terminology. And from ICD 10 cm there is 5 questions. From HIPICS 3 questions. The coding guidelines 7 questions. From compliance and regulatory, that is HIPAA, only 3 questions. And from case studies there is 10 questions. In case studies there must be combination of ICD codes and CPD codes will be there. It should be the lengthy questions from among all of them. Okay, so should give the weightage in every subject because from CPT more questions is asking from CPT section, but the coding guidelines and ICD should be thorough because you may miss the marks. Okay, the guidelines should be thorough in your mind and should be familiar with the books because from book it's an open book examination, so you can just memorize where the coding guidelines are written. Okay, so you can go and check the guidelines before marking the answer, so you can pass the examination. So you must don't avoid ICD book because many questions are from CPD section, but there will be chance to get lose your mark. So please be careful about the ICD guidelines questions and also the anatomy. You can uh, look into the CPT book and ICD books. There is many diagrams and you can check the answers from there. And also before starting every chapter there is many there is a chapter review about the systems in ICD books, so you can also refer from the answer of anatomy question from there. And the medical terminology uh, are discussed in medical terminology questions are from the CPT section. CPT in the front of CPT CPT part CPT book in the front section there is many terminologies are given, so you can also refer from there if you get any doubt. Okay, about the study material, should be familiar with your CPT, ICD and HIPICS level 2 code books or PDF. You can also select if you want to use your book, or you can use the PDF for the examination. Okay, and you should learn about HIPAA complaints, Medicare, Medicaid. So you can refer many sites or YouTube channels like this. And also you have to remember the answers of some of question, and should be thorough about ICD and CPD guidelines. This is very important because the guidelines, it's all not only about the ICD guidelines, because from CPT also there is many guidelines before using as code. So must go through the all the in CPT all the parentheses below the uh, every code, and please read it before using the code, because there may be a chance of getting uh, wrong answer. Okay, and you should be known about the anatomy and medical terminology. And as I said earlier, in ICD and CPT book there are many diagrams, so you can also refer the answer from that, and should study the modifiers. It is very important because you should know about the modifiers. In CPD section, also in HIPICS, you have modifiers. So in many questions of CPT, there will be many modifiers should be used, especially 26 modifiers, 59 modifier, 51 modifier. These are common modifier, and also ENDM modifiers should be read. Okay, you should know where the modifier list is in your textbook, so it will be easy to check. Okay, that is why you should familiarize book with your CPD book and ICD book and everything. Okay, and the time management. So you should do more practice test. Okay, mock test. Then you can get more familiar with the questions, the question pattern. You will get the question pattern, and you can uh, manage the time to finish the exam before 4 hours. So you can get some time to check if you have answered any question, every questions or not. And by doing mock test, your time management will be improved. And also you should do the questions from Blackboard, that is AAPC site. So you can do Blackboard test questions, because that is the uh, exam pattern. It is more similar to exam pattern. So must do the blackboards and revise every chapters weekly or daily. Daily revision is important. So must weekly revise every chapters. That will improve your knowledge, and you must be familiarized with the textbook, and every line in the textbook you should go while you using a code, because in bracket or parenthesis, or and also about the parent code, intended code, you must be known about what is these are. Okay, so you will get good marks to pass the examination. Don't forget, passing the exam should be a priority, and for that you have to study hard, and do not always expect for an easy questions, but there will be also tough questions. So you have to prepare yourself to uh, ease your examination, and spend time wisely during your examination. So first, in examination, first your anatomy question will be there, then the medical terminology, and then ICD and guidelines. So that is the pattern. So please use less time in answering the anatomy, medical terminology. That's a small question, so you can answer that questions easily. And for the CPT questions and for the case studies, you should use many time. So please spend your time wisely and believe in yourself. Be calm in your exam time and don't stressed out. And for avoid your stress, please reach the examination center early, because that will be a good thing, because you can familiarize with the place, and you will be calm in that situation, so you don't have to be panicked for getting late. So it's better to reach early in the examination center and take the documents, that is hall ticket. You should have your hall ticket, and in your phone the DigiLocker app should be there, and from there Aadhaar should be updated, and also or add some more data, like if you have driving license or PAN card or something, you have to uh, updated in your DigiLocker app. And in examination, uh, for going the examination, before going to the examination, the please give some importance to some of the chapters of CPT, that cardio, the circulatory system, the integumentary system, pathology, medicine, um, and these are the more and E&M. From that, more question will be asked. So you have to concentrate on these are the largest chapters, so you have to give more importance to these chapters. And in ICD, all the guidelines of every should be known, and the all the 22 chapters must be known. You have to read everything in that textbook. That will help you to pass your examination. So don't be stressed out, be calm, and believe in yourself. You can pass the examination. And all the best for your exam, guys. Okay, if you like my video, then please like, share, and subscribe. Thank you.